Abigail, we've been talking about your problems that you're having with your acid reflux today.
Yes.
So I'm going to give you Pantoprazole to help with your acid reflux. It's also known as Pepcid. Have you ever heard of this medication?
No.
So can I tell you a little bit about how it works? Your stomach has a pump that makes stomach acid, and this medicine is called a proton pump inhibitor. It helps lower the amount of acid by blocking this pump in your body. Making less acid should help you start feeling better.
Okay.
So the medicine goes to special cells in your stomach. We don't know exactly how fast it's absorbed in your body, but taking it with food can slow the process down. I see here in your chart that you don't have a history of any liver problems.
That's right.
Okay. So the medicine usually will stay in your body for about an hour. People with liver problems, it can stay in your body a lot longer. Some people also break down medicines more slowly because of their genes. Have you ever had any kind of genetic testing in the past? Okay, so we'll have to monitor the medication because some individuals, their bodies, our bodies get rid of pantoprazole through our urine. And before that, our livers break it down using a special enzyme. But people that have mutations in that enzyme, it can take longer to break it down in their body. So hopefully won't affect you. But we'll monitor it, and I may have to change the dosage of your medication. If you take this medication for a long period of time, then just so you know, the elderly often get rid of medicine slower than we do too. It's usually because their kidneys don't work as well as they used to. And since you're a woman, older people, or as you age, if you're on this medication, you have a higher chance of developing weak bones, which could lead to hip fractures when taking the medicine due to lower calcium levels. You could also develop infections when taking the medication. Let's talk about some of the side effects. The most common are stomach problems like nausea, diarrhea. If your poop starts to smell funny, then I need you to call me right away because it could be a sign of an infection, and I'll have to give you some antibiotics for that. Trust me, you'll notice the different smell. Do you have any questions about that? So if you take this medication, again, for a long time, it can also increase your risk of not having enough vitamin B12 and iron in your body. And if you don't have enough of those vitamins, then it can make you start to feel more tired. So you'll have to just let me know. Are you considering getting pregnant anytime soon?
No.
Okay. So just so you know, if you're still on this medication when that time comes, if you choose to get pregnant, then it's a category B drug and it can pass into breast milk if you choose to breastfeed. So just keep that in mind. Now, it is safe for kids as young as 5. We do have some kids here in our practice that take this, and the amount of the medication depends on their weight. There are similar worries about bone health in children, just like us adults. If you take this medication for a long time, it's also been linked to bone fractures like in children, just like hip fractures in the elderly. Do you have any questions for me?
No.
Okay, so I'm going to give you a prescription for 40 milligrams of the medicine, and I would like to see you back in 2 months so we can see how the medicine's helping you. And if you have any questions or concerns, please call the office.
Okay, thank you.
Thank you. Have a good day.
You too.